everyone, Dan Julien here, nurse practitioner for Danesthetics Medical, and today we're doing an Instagram Live with the one and only Dr. Joshua London. He is a London-based cosmetic physician. He's earned the respect of all the top providers and plastic surgeons throughout the world for his natural work and his professionalism. He's not afraid to speak his mind when it comes down to treatments that he believes work and doesn't work. He's also super dapper, super friendly. He's a good friend of mine, actually. We're going to bring him on right now, and we're going to talk all about periorbital rejuvenation. This is going to be a good one. Hey YouTube, before we jump into the video, make sure you check out my Patreon account. It's designed for serious medical aesthetics providers just like you. There we go.
Hello.
How's it going, buddy?
Very well. Thank you for having me again.
Yeah, this is a follow-up, by the way, for all of you who are not aware. We've done this, I think, a year and a bit ago. I'm always trying to reach out to, providers throughout the world, but now I'm at a point where I'm like, you know what, let's do a recap. Let's follow up with these guys just to see what they're up to, what's new, and at the same time, talk about what's new in the industry since the last time we've chatted. A few things have happened with yourself. I know you're like Mr. Periorbital Rejuvenation with your patented InclinEyes, and then he actually had surgery recently done with the prestigious Dr. Chestnut. We're gonna be talking all about that today. So let's jump in. But man, how have you been, man? What's new?
So yeah, I've been traveling a lot. Sometimes a little bit more than is dear to me. But you can't complain. It's good to be busy. And then obviously, the surgery with Cameron with Dr. Chestnut has been a really big thing the last few weeks. I'm now at week 5, 6-ish, I think, and it's kind of starting to settle. Swelling is slowly but surely going down. There's still a little bit of kind of like periorbital edema and stuff like that. That's actually not too bad at this point. They say like the hard downtime is like 2 weeks, and then the soft downtime is like 6 weeks. And so far, I have to say that's pretty spot on. The first week, especially, is not fun. It doesn't hurt, but my God, is it uncomfortable. You are so swollen and crusty and oozing everywhere. It's a lot.
So you also had laser genesis performed around there too,
yeah.
Right? So did that add to
Just
it?
a whole lot of laser. For everyone who doesn't know what happened, I had like eye bags that were a bit beyond fillers. It's called fat herniation, which is basically an excess volume instead of a volume deficit. You can't really correct that with fillers. So I had some surgery, and I also had ptosis where one eyelid hangs a bit lower than the other one. Can't really correct that with injectables either. So I reached out to Dr. Cameron Chestnut, brilliant surgeon, had become a good friend on social media as well. And we had a consultation that was actually also on Instagram Live. That was his idea. He thought, to make it just so everybody can kind of join in and see how the process goes. And I thought it was a brilliant thing to do. So we had a consultation, and he went over some things. He's like, look, I want to do this and this and this and that. And I've seen his work, and I thought, this guy he's brilliant. He understands the anatomy and the physiology of aging at a very different level than anyone I've ever spoken to, and he does specialize in the eyes. So I was like, you know what, you do what you think you want to do, and just tell me like why and how. And as he's going through it, he's like touching on these things that are like, wow, that was actually bothering me a lot, and I didn't know you could do that. And just ended up signing up for pretty much everything he said. So I had lower blepharoplasty, I had a ptosis correction, I had a brow lift, I had a mid-face lift, and I had some radius removed from my mid-cheek area, and then just like laser cocktail, and that's it. Yeah.
Your incisions, where are they? Can't see.
They're transconjunctival, so through the inside of the eye here, and then I've got 2 little slits temporally. They're like less than a centimeter. Can't even see them. I don't know how he did it.
The brow lift, is that how he does
Yeah,
that?
so brow suspension. It's not really a brow lift because it was really weird. I knew there was something bothering me about my brow position, but I didn't know what, and I definitely didn't want like high brows because it just does not look good on men. Yeah. You see these men who've had brow lifts and they look, kind of like alienized or feminized with the round brows. A man is supposed to have a flat, low brow, and if you don't, it looks weird. So I'm like, I know it's bothering me and I know it's too heavy, but I don't want to lift it. And basically, he explained it really well. He's like, I don't really care about your brow. I'm going to go in and I'm going to look for those fat pads and reposition them where they should be on the orbital rim. And the rest of the tissue is going to kind of follow suit. Like, we're not going to pull the skin to try and get your brow up. We're just going to rearrange the subcutaneous tissue to where it should be on the bone, and the rest is going to kind of follow. And I'm like, wow, that actually makes a lot of
Yeah.
sense. Because when I think brow lift, I think, oh, you're just going to pull the skin, stitch it up here, and that's that. But that's not what he did at all. He did suspend the temporal fat pads and attach those, which also was amazing. Didn't even know he was going to do that. But they just look a lot more open. I don't know how. I don't know what kind of witchcraft it is, but it's exactly what I wanted.
Okay, great. So the other thing too is that you recently spoke at Dr. Subbio's needle art convention. How was
Yeah.
that? Tell me a little bit about your talk. You don't have to say the whole thing, but just give me a little bit of description of. You
I
probably
mean,
talked about your InclinEyes. I
honestly,
wish I could have made that. Couldn't
oh
make it.
man, you missed out. That was a big one. Honestly, just the fact that me, the little nobody from London, is speaking between Kami Parsa and Ben Tale, like titans, absolute titans of the industry, was extremely humbling. And we actually had a panel later, and I was literally sat in between Kami and Ben, thinking like, wow, how is this my life? Like these guys have got like 15 years on me.
Yeah.
Like how is this even a thing? Very, it's an incredible opportunity to be able to do that, especially at this point in my career already, and to be recognized for, the things that I'm doing and putting out there. And then to see, kind of hundreds of people there, all just clinging on to your every word was an amazing experience. I've done some little talks before, like, 10 minutes here, 20 minutes there, a little live injection on stage, it's all very cute. But, if you're flying transatlantic to do like an hour and a half talk on extremely niche treatments and have everyone cling to your every word. Yeah, that was a very surreal experience for me. I had to kind of pinch myself a little bit there.
If you feel comfortable, can you talk a little bit about your InclinEye treatment? What makes it unique?
Yeah, so basically, we're going to do training courses on this, so I don't want to delve into it too much.
Just give people a
But
little touch.
yeah, so this is basically the first time that I was ever speaking about it publicly, because I've always been, kind of a bit hesitant of doing that, because, you've done upper eyelids yourself once or twice before, like we've talked about it before, and you'll know it's a really tricky area to get right. And I fear that if I talk about it too freely sometimes, I'm just going to unleash a whole lot of stuff into the world. Because ever since I have started doing and posting it, I have noticed that people locally are becoming a lot more bold in treating it, leading to the complications that brings when you do that without sufficient training or experience. The more I'm posting about it, the more I see that local people who've never done it before all of a sudden are doing it, and then ending up with like sausages and bumps and toasts and heavy lids and edema and all that stuff. That's relatively preventable. But we're here now to talk about it, so I might as well a little bit. So basically, what happens in certain people as we age, and in certain people just genetically, they just lose a lot of fat in the upper eyelids, or they might not even have it to begin with. And what happens then is you get a more kind of round, hollow-looking eye as opposed to an almond shape, which is considered to be youthful, aesthetic, energetic, kind of sexual. If you want to call it that. And then as we lose that, especially people who used to have that, and they get that little hollow, which is called an A-frame deformity, which is basically a deflation of that fat pad there. And it makes you think like your eyes drooping, or like you need a blepharoplasty. A lot of these people come in and say, oh, I've got so much excess skin, I'm so droopy, because they're hollow here, creating a shadow here, but they're not hollow here, so they've got light reflection here. And what that does is it creates a negative vector. So it creates a downwards V shape, which, everywhere in the marionette lines, in the nasolabials, in the tear troughs, in the eyes, negative vectors, downwards Vs are aging, and upwards vectors, are youthful, energetic. So it creates the appearance of heaviness and droopiness when there actually is no heaviness and droopiness in that area, which makes it an extremely interesting thing to treat, because this is one of the areas where you can probably give the biggest illusion of lift just by using volume. Because if you're restoring that little bit, then all of a sudden you get more light reflection here than you do here. And all of a sudden you've turned that negative vector into a positive vector, and it looks massively lifted in these people who thought they needed surgery or God knows what, and they really don't. So that is like the principle of it. That's the beauty of it, is you're playing with lights and shadows and light reflection. And that is why it's so impactful.
Yeah, absolutely. The other thing too is, like you mentioned, you're seeing a lot of other providers do it, but the whole idea, and I tell my clients this too, I said, listen, the whole idea of you being here is because you've seen natural results. And natural results means that when you leave, you and I are going to notice the difference, but no one else should be able to notice the difference.
Exactly.
And that's kind
And
of
I
like
always say that verbatim. Like, no one else is going to know that you've had your eyes done. They're just going to
that's
look at
right.
you and they're going to be like, wow, you look fresh. Like, have you had a holiday? Have you had a good night's sleep? Not, oh, you've had your eyes done. You
A
want
lot
that.
of providers miss the mark with that, and what happens is they overfill, and that's the tricky part with the upper eyelid. Is like you really need to go slow with the right product, just enough to restore that to make
Yeah.
it kind of, you know, connect uniformly. Where if
Yeah.
you're trying to do anything excessive, I had a client that came in, a masculine client, and they tried to drop their brows by overinflating this, and I had to dissolve all
Yeah.
of it. I said, listen, this looks ridiculous. You're missing the mark,
Yeah.
and
Yeah.
what we're trying to do is just basically rejuvenate the eye, not reposition an eyebrow in any way, particularly dropping it
Yeah.
with this
Yeah.
stuff. So a lot of people are kind of overdoing it, missing the mark, and this is where the subtleties are important. So the other
Yeah.
thing too is that, with regards to eyebrow position, are you also including a little bit in just the upper forehead and the temple region in
Yeah.
order to kind of just make sure everything's suspended? Why would you do that?
So that would be the difference between the upper eyelid filler and the InclinEyes. Is InclinEyes, you add a little boost to the tail of the brow. It's just kind of, I never say lift,
Mhm.
but to kind of flick the tail out a little bit. But it only works if you have some flatness there. So people who have like some flatness behind the tail of the brow, anterior temple, lateral forehead, they're great candidates for InclinEyes. People who've got a perfectly nice round transition from forehead into temple, into cheek, they are not good candidates for that, because that same concept of volumetric expansion that you're relying on for your lift won't work on them. If anything, you're going to give them a ridge, like a Neanderthal brow, which is going to create an appearance of heaviness. So you're going to be doing the opposite. So, for both, for upper eyelids and for InclinEyes, it's really important to do proper patient selection. I suppose for any procedure, it's important, but these are, you can't just do this on everyone. You have to be careful and picky in your patients.
Thanks
All
for this,
right,
man.
take
This
care,
is terrific. Thanks
man. Thank
everyone
you
for
for having
joining.
me.
Till the next time, man. This is
All
terrific.
right.
Can't wait to see you at the end of January.